Today, our lecture would be on impact of illness on the family. The impact of illness on the family discovers the meaning of illness for the family. It investigates the disease, examines clinical and laboratory evidence of biologic and psychophysiologic dysfunction, and it investigates illness as well as it explores the meaning of disease to the patient and to the patient's family. Major illnesses involve loss of body parts, ability to carry out normal and treasured activities, sense of self-esteem, dreams and plans for the future, and sense of invulnerability of oneself and loved ones that keeps fears of impending death and separation at bay. The family illness trajectory shows the normal course of the psychosocial aspects of disease for the patient and the family. Knowledge of trajectory allows the physician to predict, anticipate, and deal with a family's response to illness. It indicates normal and pathologic responses, thus enabling family physician to formulate special therapeutic. There are 5 stages of the family illness trajectory, which we will discuss in our slides later on. Stage 1 is the onset of illness to diagnosis. It is a warning sign such as malaise as the preliminary stage of the illness trajectory. Stage experienced prior to contact to medical care providers, and medical beliefs and previous experiences influence meaning of illness. Nature of onset may play an important role on impact of illness on a family. So it could be acute, nature of illness, or rapid. Nature of onset could be rapid or clear. Characteristics of experience, there could be little time for physical and psychological adjustment, or there's a short period between the stages, little time to remain in state of uncertainty. What is the impact on family? Sometimes it's caught up in suddenness. You have to deal with immediate decision making, often with little support within and outside the family unit, and if less threatening, may be dramatic but less crisis-oriented problem for the family. If it's a chronic debilitating disease, nature of onset is gradual. So you suffer from state of uncertainty regarding meaning of symptoms. So there's a vague apprehension and uncertainty. So there are fearful fantasies and anxiety over the denial of seriousness of symptoms and possible implications. The stage 2 is the impact phase, and it is the initial reaction to diagnosis. So there's an emotional plane and a cognitive plane. Emotion deals with the onset of illness. It's initially denial, disbelief, and anxiety. This is followed by emotional upheaval, anger, anxiety, depression, and the last phase is accommodation and acceptance of the diagnosis. The cognitive plane has 4 phases. The phase 1, initial tension and confusion with probable lack of capacity for problem solving. The second phase is a repeated failure in deriving diagnosis may lead to exacerbation of tension and increased distress. Phase 3 is an increasing assessment and receptivity of family to new approach for relief of distress. And phase 4 is acceptance of diagnosis and able family to mobilize resources. The third stage is the major therapeutic efforts. So there are critical issues in choosing the therapeutic plan. Psychological and preparedness state of the patient and his or her family should be assured. Assumption of responsibility for care and responsibilities of each party. The economics of the therapeutic plan. Lifestyle and cultural characteristics of a family, and hospitalization gives rise to stressful logistic problems. Stage 4 is the early adjustment to outcome. It's the experience of recovery of adjustment to the illness outcome varies according to the type of outcome anticipated. So it could either be return to full health, so simplest gains from illness experience, so regaining health after getting pneumonia. Partial recovery is followed by period of waiting to learn if disease will return or fear of death. maintain constant sense of vulnerability. So it could be cancer in remission, so completing a 6-month regimen of anti-TB meds, or permanent disability. So, for example, a bilateral knee amputation for a neuroischemic foot ulcer. Stage 5 is the adjustment to permanency of outcome. So the second crisis occurs as family realizes that they must accept and adjust to the permanent disability. Family must accept that life goes on. Continued unwillingness to incorporate reality of permanency may be sign of pathology. So for acute illness, potential for crisis when family routine is suspended, emotions are high and can lead to anger, especially if medical care is perceived to be inadequate. For chronic illness, it's a prolonged fear and anxiety causing higher incidence of illness in other members of the family. It brings about additional burden, feelings of guilt, especially if patient was previously neglected, overindulgence towards sick members, feelings of overwork, anger, resentment, and guilt. For terminal illness, initial response is of shock and overwhelming anxiety. It's a highly emotional and devastating grief reaction. If functional family members are drawn closer, if dysfunctional, seed for family discord and breakdown ensues. Aid in deficient and functional readjustment, provide quality care, home care is best. So there are steps in the family systems approach. So we have to recognize the family structure. So we have to have a graphic representation of the members of the family, understand normal family function, dynamic image of relationships in the family, and learn to assess family structure and function in clinical practice. The family physician should listen more and talk less. So in our following lectures, we would learn about family assessment tools that would help us assess the family and know how adaptable they are in facing disease processes or disease illness in the family. Thank you for listening. This is our preventive medicine and community health lecture. Please do subscribe to our PMCH channel for further PMCH lectures. Thank you.